Gather and clean required examination equipment. You will need a mirror and a nasal thudicum or an otoscope with a large attachment. Ensure appropriate infection control by decontaminating your hands. Introduce yourself to the patient and check their identity by confirming their name and date of birth. Explain the examination and seek verbal consent to proceed. Consider if a chaperone is required. Ideally, the examination is best carried out with the patient sitting in a chair with space available behind the chair for the person carrying out the examination. Assess the patient for any distress and ensure they are well enough for you to proceed. Look for any signs of respiratory distress or airway obstruction. Ask if they have any pain or other symptoms, clarifying the side affected. The examination follows an inspect, palpate, rhinoscopy, special tests structure. Start by examining the symptom-free or better side. Start by inspecting the face and nose from a frontal view, then move to the lateral view, and finish looking above the patient from a bird's eye view. You are looking for signs of swelling or infection. Is there discharge? If so, what color? And erythema. Scars are commonly placed on the columella and can be difficult to see. Look for traumatic scars. These will often be over the bony part of the nose. A rhinoplasty assessment is beyond what is expected at your stage, but from each of the aforementioned views, you should assess for any significant asymmetry in nasal alignment. The nose can be broken down into the bony superior third, cartilaginous mid, and lower thirds, and you can mention if there is deviation at what part of the nose this may be. Palpate the nasal bones, superior third of the nose. In clinical practice, in the acute phase, this can be very tender when assessing for a nasal fracture, so confirm the patient can let you know if it is too sore to continue. You palpate the nasal bones for movement and feeling for steps or breaks in the nasal bones. Palpate the cartilaginous part of the nose, primarily assessing the support of the lower part of the nose. This is a difficult skill to learn with the thudicum speculum, and most people will therefore use an otoscope. You are assessing the first part of the nasal airway. In a normal examination, you should be able to comment on the nasal vestibule, septum, inferior turbinate, and any obvious pathology in the inferior or middle meatus, such as mucopurulent discharge or polyps. When there is significant mucosal edema, you may just be limited to the septum and inferior turbinate. The septum is never straight, but you should be able to see and comment if there are significant deviations in the septum. The inferior turbinates are often mistaken for nasal polyps. The turbinate is a pink-red color originating from the lateral nasal wall. A polyp often has a grey or yellow color to it, and on an interior rhinoscopy, you would be able to see the origin of it. For a more complex explanation and endoscopic images, please see the extended video on the ENT second year site. To assess airflow, there are many tests you will read in the literature. At your stage, there are two tests that are straightforward and easy to perform with limited equipment. The first is the sound of nasal airflow. Get the patient to gently occlude the nostril by placing the thumb over the nares. Don't push laterally, as this will often displace the cartilage and give a false sense of block. Listen to the airflow and compare the sides.
And do the other side.
Turbulent airflow is noisy compared to unimpeded flow. The second test is a nasal misting test. This is often best performed on a mirror. Check the mirror is clean and then place just under the base of the columella and get the patient to breathe normally. Observe the airflow in terms of amount of flare and the shape and compare the sides. Smell testing is easy to perform. For an OSCE, you will likely not be asked to demonstrate this, but should have an understanding of how to do this clinically. There are many methods of testing, but we use an upsit test, which is a validated scratch and sniff test with normative data allowing for changes in age and gender. Complete the examination by explaining you would like to assess cranial nerves 3, 4, 5, and 6. Clean the examination equipment you have used and perform appropriate infection control by decontaminating your hands. Thank the patient. Explain your findings to the patient and complete appropriate documentation in the clinical record.